Hi there, good afternoon, and welcome to our next panel discussion. My name is John Dugdale. I am the Operations Manager at Spectra. And along with our colleagues from METRO, we are commissioned to deliver a number of services in the kind of Wandsworth and Richmond boroughs. Today's discussion, as the title suggests, is regarding PrEP. We were together last month and we were talking about everything that evolved around RSE in September. And in the next coming months, there's going to be discussions focusing around World AIDS Day and probably kind of issues around mental health as well. First of all, I would like to say a big thank you to Julian, who is the Commissioning Officer for Sexual Health and Service Development for Richmond and Wandsworth Councils. This webinar will also be available on their respective websites at the end of the hour. So without ado, I'll get started. First of all, I'd like to introduce our panel today, and I'll let them do that themselves. Again, we're joined by colleagues from METRO, from Spectra, and we're very lucky to have Mr. Will Nutland from PrEPster. So perhaps Gianluca, if you want to go first.
Hi, I'm Gianluca. I work for Spectra, and I'm the HIV prevention coordinator for our GMI partnership. Next one.
Edith, how about you? So you're on mute, Edith.
Hi, my name is Edith and I work for the METRO Charity. I'm the HIV Family Support and Advocacy Manager. Thank you. Thanks.
Jose?
Yeah.
Hi, everyone. My name is Jose and I work I work for METRO Charity for the SASH program, and I run HIV support and groups for men living with HIV. Excuse me.
Someone's got a frog in their throat.
Sorry about that.
That's okay. And Will, finally.
Hi, good afternoon, everyone. My name is Will Nutland. I'm the co-founder of an organization called PrEPster. It's so lovely to be here with you this afternoon. Great to be here with friends and colleagues from Spectra and METRO. Thank you for having me.
Thanks for being here. Also, hopefully we might be joined by some of our colleagues from CLCH who are based out at Falcon Road, but I know they were having a slight difficulty, so they might come in later. Anecdotally, I mean, for me, this is PrEP has always been a kind of a real game changer. I think, you know, I've only worked in this kind of sexual health sector for 3 years. And personally, you know, as and I was thinking, I was trying to type the dates, you know, back in 1987, you know, when as a 15-year-old kind of gay lad living in Yorkshire and seeing those ads about AIDS and the tombstones, you know, it was weird. You know, I look back now and think, oh my God, that was just frightening. But kind of fast forward 30 odd years, and you know, we're now in a position where we have, you know, this PrEP, and we have, you know, the kind of work that is done around kind of, you know, U equals U and undetectable, and kind of getting that message out there. So, but I appreciate for people in our sector, we're aware of what PrEP is. We've known about PEP, you know, and so on and so forth. And there's been a lot of kind of work being done behind the scenes in leading up to, you know, it's finally, I say finally in capital letters, being rolled out on, you know, the NHS. More about that to come later, hopefully. So I think, you know, for perhaps a wider audience, we should kind of, you know, sort of look to, you know, a few things like, you know, what is PrEP? What does it stand for? I guess. How does it work? How effective is it? You know, there are a lot of perhaps people out there who aren't aware. And I know Edith's got some information on perhaps, you know, a survey that was conducted recently into kind of, you know, PrEP being accessed by different communities. I don't know. Let's start. I mean, Will, you know, you're the first person to go to. I mean, obviously for you, it's been a personal journey as much as anything else. I mean, can you kind of give us a rundown of, you know, of what it is, what it does, how it works, etc.?
So, John, like you, I remember the kind of the very early days of HIV, not just in the UK but globally, and you know, we do use this cliche term of PrEP being a game changer, but it really is. Public Health England just this morning have released their new data on HIV, and we've seen again another about a 10% fall in HIV diagnosis, and this fall has not just been in the groups of people who we saw the big falls in 3 or 4 years ago, gay and bisexual men. The falls are happening in almost every demographic group, if not equally. So it is a cliche to say a game changer, but it really has been. And I think it's important for us to not just to say this is all down to PrEP. This is down to a number of things, including a massive increase in the numbers of people who are testing for HIV every year, a large number of people who are being diagnosed with HIV being offered treatment almost as soon as they're diagnosed. But add PrEP into the mix, and this is where we're starting to see the really, really big falls in HIV diagnosis, particularly in places like London. So it's a game changer. PrEP is generally taken in a pill format. It's taken both before and after sex. So although it's called pre-exposure prophylaxis, it's really important that we reiterate to people who are thinking about using PrEP or who are taking PrEP that PrEP needs to be taken around an episode or episodes of when potentially sex that could expose you to HIV will happen. Most people who use PrEP take PrEP on an ongoing basis, on a daily basis, so taking a pill every day. Some people decide to take PrEP because they know that they have a particular risk episode coming up into the future. We've also kind of laughingly talked in PrEPster about someone having a dirty weekend in Berlin. But it might be that got a holiday plan, or a particular sexual partner is coming to visit, or you're going to visit a particular place where you know that you're maybe not going to use condoms or be less likely to use condoms. So
I have to agree. I mean, sorry to interrupt, but I have to agree. But a friend of mine basically was going to Ibiza for a week, and it was like he said, "Oh, you know, I don't take it daily. I forget to do the kind of 2 T's, 2 S's kind of thing." And he was like, so for him, because he kind of tends to know that he's going to have these episodic periods of, you know, activity, shall we say, that, and so I was like, you know, so basically he knows that, yeah, we call him, he's off his dirty week in Ibiza, so therefore, and we're not kind of being disparaging or anything, but he knows that if he takes it for the week or maybe a couple of weeks prior, takes it for the week while he's away, you know, and it's not just that, you know, but it's trying to stress as well, I think, to people that it doesn't prevent everything, so there's still an element of safety around kind of STIs and so on and so forth as well, you know, so yeah, sorry I interrupted, but I wanted to agree with you, yeah. So kind of moving on, I mean, obviously for the uninitiated, I mean, how does it work? Let's talk about them, I suppose, the medical side of things. How is it effective? How does it work? And maybe again to Will, and then perhaps Gianluca, you might have some anecdotal evidence of, you know, people you've seen in when you've been doing outreach as well.
Sure. So let's keep it basic, because I don't think any of us wants to go into the elaborate science of this. But the most basically, PrEP prevents HIV from replicating inside of your body if you have been exposed to it. Excuse me, I've got Jose's cough down the line. So I am in real life a PrEP user, and if I happen to have sex with someone who has HIV and has a detectable viral load, that means that they can pass HIV on. Then if I have sex that exposed me to HIV and HIV got into my body, what the PrEP does is stop that very small amount of HIV from replicating and taking hold inside of my body. So that is in essence how PrEP works. For PrEP to be effective, you need to not already have HIV. You need to have tested HIV negative or not to have HIV. If you already have HIV, then the types of medications that you take, whilst very similar to the medicine that's in PrEP, is not efficient. It's not sufficient to treat your HIV. So it's really important that before you start using PrEP, you've had an HIV negative test. Gianluca.
Yeah, I mean, Gianluca, I mean, you know, you are obviously you was an outreach worker. You kind of, you know, over the years have been kind of going out into the, you know, into the communities, various locations. We you know, in London, and obviously, you know, ranging from kind of, you know, public sex environments. You know, we've done outreach work in libraries, predominantly in Wandsworth and Richmond. A lot of our work is in libraries, kind of outreach centres, kind of thing. And obviously, yourself were a PrEP champion. Obviously, you know, was a project that you know we were all part of. Do you have sort of any kind of comments on, you know, what it was like when you first started educating people about PrEP, how it is now, people that you've perhaps kind of, you know, you've had sort of conversation with and they've gone, oh my God, I didn't realise, I didn't know about it, I didn't, you know, yeah.
Yes. I think many people, at the beginning, there was a completely different reaction than later on when more information went out and we were more educating people in a way around PrEP. And there was a bit of less stigma around it, because immediately I remember there was like a big stigma about PrEP and PrEP users. But while people understood more about it, actually it's becoming a very good option. And a lot of people, they actually wanted to know how to get PrEP and where to get PrEP, and and then like they were actually checking what kind of dosage was the best for them, if it was a daily base or an even base. So yeah, I think the perception has been changed radically from what it was at the beginning when we started approaching people around it.
Cool.
I don't know if you will agree with me. I think you've done a lot to reach around PrEP as well.
Yeah, I think Gianluca's right. I think in the early days when the PROUD trial, which was a trial that recruited about 550 gay and bisexual men in around 2013, 2014 kind of time, it was actually hard to get people to go on that early trial. There was a lot of stigma about PrEP. I know, John, you and I just used the language of a dirty weekend away, and that in itself, using that terminology, helps to probably contributes to the stigmatization of PrEP, because PrEP isn't just for a sense that in the early days PrEP was seen as for people who were having lots and lots and lots of sex, and PrEP isn't just for people who are having lots and lots and lots of sex. It could be it could just as easily work for someone who is or perceives themselves to be in a monogamous relationship. So a lot of stigma in the early days. And I think my experience has been from the community events that we've been doing that PrEP has really become normalized, at least amongst gay and bisexual men in places like London and Manchester and Brighton and Leeds. But I think as we're going to learn as we go through this hour-long event, that's not the case for all communities. And we've definitely got work collectively cut out to make sure that PrEP is as destigmatized and is as well known about and is as available amongst other communities, in addition to gay and bisexual men.
Definitely. I mean, to be honest, you couldn't have given me a better segue, because obviously, so Edith, obviously you we were talking earlier before we started about how a recent survey you'd done kind of highlighted some different findings for different communities. So do you want to kind of expand on that as well?
Yeah, thank you all for sharing your experience. I think actually it's very interesting at this time of the year with what is going on, because I just wanted to explain a little bit my background as well, having worked in the HIV sector for a long time, for about 18 years, and also remembering the time when HIV/AIDS in sub-Saharan Africa, where I grew up from, was really having the worst impact there. And when I compare this time, and then I think about the survey we did in the community, that was last year, I think. We did a survey, and Metro was involved in in the PrEP trials. So we were actually out in the community, like partners, and talking to people and trying to educate them about PrEP. And most of the, the questions that would come from the community as well, especially the BME communities were involving in, they didn't know about PrEP. So we were telling them what PrEP is, and they would ask, oh, where can we go and find PrEP? Is it free? Is it, so I think the important thing is now that I think we are hearing some good news, especially when it comes to probably free access to PrEP in the near future. You probably have to correct me there, but I think that's what we are hearing. So mostly people were asking how they can get the PrEP. Can they access PrEP on the NHS? Can they go to their local GAM clinic? And yeah, people wanted, especially the Black community, and we engaged with women as well. And although most of them were a bit like, oh, how can I take PrEP? How, they wanted to know more about taking, how to get the information and knowledge and where they can access it. So I think PrEP is some good news for all communities that might be highly, at exposure of HIV. So yeah, it's all good news to hear about PrEP, really.
I think as well for me, sorry, just before Jose, I was going to pass it to yourself. I think it has been for a while a misconception, not a misconception, but an understanding that it was more to do with kind of gay communities, MSM communities. I think for other communities where perhaps people, and there was a kind of an online story I read recently about a woman who wasn't particularly in a stable relationship, wasn't sure where her partner was going to kind of have sex. She was concerned about, could she perhaps, be open to contracting HIV. And so for her, the thought of taking something that would perhaps sort of, eliminate that possibility as well is, I think, is something that we need to do. It's a big kind of, it's a big task. It's a big kind of, awareness campaign, if you like. It's a re-education campaign for people to be aware that it's not just for kind of MSM or men. There are far wider reaching, kind of, consequences and uses for PrEP as well. So, but I think that's there's still a lot of work to do. You correct me if I'm wrong, Will. I think we're still kind of at the early days of trying to educate people. Jose, I mean, do you have anything to add to what Edith was saying, or anything as well?
Prague is gone. Sorry about that.
Excellent.
I work actually for METRO, and I do HIV support work for the SASH project for gay men living with HIV. But I kind of wanted to just mention a little bit. Some of my work at METRO was working with heterosexual Latinos, actually. And I think what I wanted to add there is that the knowledge among like gay, bisexual, the gay population around PrEP is probably really high, but amongst heterosexuals, specifically, my experience with working with Latinos is that it's quite low. So I think there's still a lot of work that needs to be done, especially getting messages out to that community so they know what PrEP is, what it's for, and if it's right for them. I guess that's what I wanted to add to that bit.
And again, your kind of experience over, say the past 5 years, talking to different people in different communities, have you seen a change in people's understanding or people's, thoughts about accessing it?
I'm not sure. I think what I have seen though is that when we do talk about it, they're really open and want to talk about it. So I think if that opportunity is there for people to learn about it, I think we could change attitudes. So we think we could change the way people think about, reducing a bit of the stigma of that HIV is just a gay thing, and it's not. So I really don't know if I haven't seen, I guess, specifically the changes, but what I did remember seeing is once the topic was brought up and once people started talking about it, they wanted to learn more. They wanted to, especially for some heterosexual people that we speak, they want their kids to know about it, which I thought was a great sign. So, yeah, I can't really say if it's changed. with the heteros, but I just want to emphasize that they really did want to learn about it. So they the opportunity is there for us to spread the message, I guess, a bit more.
Yeah, no, I think there's a lot of work to do, kind of, for wider communities. I think, and Gianluca, I don't know, you may kind of disagree, but from personal experience, if you're using kind of different, or I've seen friends using different apps, and and they'll be having a conversation, and one friend in particular, he is quite out about his HIV positive status, and obviously he's very aware of his meds is on, and people take PrEP and the U equals U message, and he's still kind of coming up against some ignorance. People are still, in a community that is supposed, that we're supposed to be kind of quite knowledgeable about these kind of issues. He was, chatting to somebody for a number of hours and then disclosed his status and then was completely ghosted. And it was kind of like, really, he disclosed that he was on PrEP. He's, been on treatment for some time. Do you think there's still a sort of inbuilt stigma within the MSM communities, the gay communities, to a degree sometimes?
Yes, I completely agree with you, John. And we find the stigma every day. Like there is a lot of misinformation out there. So, and it's even the language we use. Like more people they focus on HIV positive more than undetectable. And undetectable is a clear message that means untransmittable and is safer than someone who actually you don't know the status. But at the same time, people don't know that there is some option for them as well. So if they are still stigmatizing someone that is HIV positive or undetectable, they can use PrEP, as Will was saying before. And as you know, it's actually, John, what we do every day, trying to tackle stigma down around all of this. So yeah, I completely agree with you. Unfortunately, we still need to put more messages out there and let people understand that it's 2020. We have a lot of prevention methods, and we can all live happy and safe together, I think.
I agree. In my early days of kind of, outreach, I remember being in a bar in Soho and, chatting to somebody, and he'd been was kind of engaging in a sort of on-off kind of relationship with somebody else, and was kind of looking to kind of get more information about PrEP because he'd been told about it, but it was like, is it true? I can't believe him. I haven't seen him take a pill. Is this the case? And it was like, and there was this moment when I was talking to him, and the light bulb almost switched on. It was a kind of almost like a revelation of, oh my God, he's telling the truth. This thing just exists. It's great, and what have you. So yeah, we're just waiting for more light bulbs to start flicking on, and people perhaps kind of, getting to grips with it. I think obviously for people watching, if you do have any questions, please put them in the comments, or in whichever particular kind of medium you're using, be it Facebook, Twitter, YouTube, etc. And if we have time, we'll kind of come back. I guess the next step is moving on to what has always been, I think, a contentious issue: access to PrEP. For many years now, people have had to kind of access it by buying it themselves. It's kind of, over the years become more affordable. And I suppose now, following the Impact Trial, we're told that, it's going to be available in NHS. I suppose, Will, I'd like you to comment or kind of perhaps come in on this. I mean, there's a lot of information, again, about when it's available. I mean, I've seen it advertised, I can get it in Superdrug. I'm like, when is it available, and how will we get it, and is it true, I suppose?
So, John, the good news is that PrEP is now available in England on the National Health Service. It's been available in Scotland on the National Health Service for a couple of years. Scotland were ahead of England, and we've been able to learn a lot about implementation in England thanks to our friends in Scotland. So it is available on the National Health Service. So if you were one of the 25,000 people in England on the Impact Trial that finished last month, then you should go, if you want to continue using PrEP, then you should go to your trial center, the sexual health clinic that was providing you with PrEP through Impact, and tell them that you want to continue. Your trial center will just continue on giving you PrEP into the future. If you weren't on the Impact trial and you want to start PrEP, then over time, over the next couple of months, every sexual health service in England will provide PrEP. Now, it's going to take a bit of time for all of those services to get up to speed. Excuse me. Some of the central London clinics, such as Burrell Street, Dean Street, Mortimer Market Centre, Homerton, have already started providing PrEP for people, for new starters. But that's not the case in every clinic. And obviously, all of the stuff going on with COVID has made it slightly harder for some of those clinics to start to be able to provide PrEP. But the good news is that now it's available through sexual health services. John, you mentioned some people are buying PrEP online. There are safe and legal ways of doing that. Go and have a look at PrEPster's website if you want to find more out about doing that. Until recently, we think there were about 20,000 people across the whole of the UK who were buying PrEP in that way. But you've also just highlighted that now PrEP will be available through other places like online, high street pharmacists may start to offer PrEP. We're not quite sure exactly the process for how that might happen and if you would need a prescription. So I think wait and watch this space. But right now, if you need PrEP, you think that PrEP is right for you, go to or phone your usual sexual health clinic and ask them to be put on the wait list to start PrEP. If you don't currently access the sexual health service, you can go to any service in the whole of England. You don't need to give your real name if you're worried about that. You do need to give a postcode, and that's because of how PrEP is paid for. But also, if you're listening in and right now you are studying in the UK or you don't have secure immigration status, for example, you should be reassured that services at sexual health clinics are available to everybody for free, so no cost. Treatments do not cost you anything. And PrEP is the same. You will be able to get PrEP for free in the whole of the UK, regardless of your ability, your legal status, whether you're a student, whether you can work here. So please don't let those things hold you back. And a reassurance that none of the staff in any of those clinical centres would or are able to give your details out, excuse me, to either the police or the immigration authorities. So again, a reassurance to anyone who's listening who is concerned about accessing those services for things like immigration reasons. They cannot and will not give your details. So please don't let that hold you back.
Great. I mean, yeah, hopefully it would be something one day we could literally just walk into Superdrug or Boots and buy it over the counter. That would be awesome. Obviously for people, residents of Wandsworth and Richmond, obviously, there are facilities, sexual health clinics in the area. The main one, which is kind of run by CLCH, who we are commissioned via Wandsworth and Richmond councils, at Falcon Road, which is near Clapham Junction Station, will be routinely rolling out PrEP from early December. But I mean, that was announced prior to obviously what's with the new lockdown. So that may change, but I would like Phil, Will said, I would perhaps just, give them in touch, get in touch before you do that. Will mentioned a couple of website details which are currently going across the bottom of the screen from PrEPster, which are a great resource to kind of get some information if you're not wanting to wait to get it on the NHS and you're wanting to access it and kind of buy it privately through a kind of credible sort of resource. So yeah. I guess we've touched on, a bit about the Impact Trial, which was obviously the kind of the precursor to PrEP being available in the NHS. What about the findings from the trial? I mean, do we kind of, will they be published publicly soon for people? What, are there any kind of surprising findings, anything that we weren't surprised to find? Will?
Sure. So I'm on the Impact Trial Community Advisory Board, and this is one of the things, John, that the Community Advisory Board has been really pushing for, that we want to learn from the findings of the trial. So some of those early findings are likely to be released in the new year. Bear in mind that the trial only closed on the 12th or 13th of October, so they're still crunching data from 25,000 people. Excuse me. I think we should be reassured that the data from the last 3 years, though, hasn't just sat on a shelf. The ongoing findings, the interim data as it's being analysed, has been seen by people from Community Advisory Board member groups. It's helped us to inform things like how we encourage different groups of people to access the trial who may not have been the first people in line to get onto the trial. And it has helped to influence the provision of PrEP through the NHS. If you bear in mind that when the Impact Trial first started, there were only 10,000 places available, and then those places were very speedily filled up, and then another 13,000 places were made available. This is a really good example of how the findings from the trial helped to inform both future NHS service and the development of the trial itself. So knowing that that number of people wanted PrEP in a very short period of time helped all of the commissioning decisions that we're now seeing come into place around NHS decision making. So I think we should be seeing some headlines from the trial in international conferences and journals coming up in January, February or March time. And then for the next year or so, we should be seeing some really great data coming out, including questions such as how are people using PrEP, what different groups of people have been accessing the trial, are there differences in demographic groups between people who start PrEP and then stop PrEP. All of these kind of interesting data nerd questions are going to start coming out in the next couple of months' time.
Cool. Again, I'd like to open it up to maybe Gianluca or Edith and Jose. I mean, the Impact Trial was something that was kind of on our horizon for a while. I mean, Gianluca, when you were kind of outreaching and and obviously advocating for PrEP, what do people? Are there any anecdotes you have from from outreach about the Impact Trial?
Oh yes, it was like really different among the community, but there were like people that as soon as we were informing them about the Impact Trial and how to join it, they were actually, maybe if we were in an outreach session in Seoul, like they were straight away going to the nearest sexual clinic there to try to join the trial. We had like some information about people living just on the outskirts of London, and that was more difficult because there was not even the right information out in the sexual clinic in how to let people join the Impact Trial. But for sure, there was like a really big interest in being able to get PrEP for free, even just to try if it was the right prevention method. So it was actually really, really interesting what we saw in the community in this period.
Edith, Jose, if you any comments, and did you come into any sort of contact with people accessing the Impact Trial?
I guess for me, my experience when it was going on was some of the men were having trouble finding a spot towards the last couple of, I would say last year. We were trying to help people while there were spots open. I think they allocated some spots for heterosexuals as well. So those spots seemed to be quite open. And the work I was doing was trying to get people who needed PrEP and were heterosexuals to get into it. That was quite easy. I guess another comment I would say is that sometimes heterosexual people didn't qualify for the actual reasons to be on PrEP. So an example would be a woman who's not sure who her husband is having sex with, I felt that like some of the medical professionals that I would speak to didn't think that they would qualify for it. So I think that was something that made it a little bit more difficult as well for heterosexuals that it would have been good for to be on. So that's what I recall happening towards last year, really, with the PrEP Impact Trial and the community that I was working with.
Edith, any comments, anything to add?
Yeah, I think what I can add is because we had a lot of these questionnaires and were involved in also in HIV testing around the same time. So when we were talking to people about PrEP and how, how they would feel about it, some of them definitely, especially women, they would say, I remember some, a few Black women say, "Oh no, you know what? I'm married. I don't take, any pills about this. I'm married and my husband is faithful." So the whole information was about, encouraging people to get more information, and if they can take PrEP and give them control over, protecting themselves from getting HIV, and also to encourage people actually to go testing, because we had an outreach bus. We would get HIV testing and instant testing. So it's kind of that conversation, the PrEP conversation in the community helped also to improve HIV testing. That's what I can also add.
Okay. I think, it's been a kind of, Will, you might agree, a kind of a hard fought past 3 years, to try and kind of get to this stage. You must, just from that point of view, do you feel kind of validated now? Is that a word? Is it kind of, it's not like the job's over. There's that, I suppose, what now and what's the future, do you think, of PrEP? Possibly.
So, John, for me, I don't feel like it's a hard fought 3 years. It feels like a hard fought probably 12 or 13 years. Of course, because we've known about the potential for PrEP for a long time. I mean, the Iprex Trial, which was an international trial but primarily focused on the USA, reported in 2010, 2011, so 10 years ago. The PrEP was approved for prevention in the USA 2012. So we've known about the potential for PrEP, excuse me, for a long time. And in the very early days, most of the research attention went to using instead of PrEP, using it in a pill-based format. We looked at using it both vaginally and rectally in a gel or a topical format. That might be worth us just holding on to that conversation of other formats of PrEP into the future of today's conversation, because I think it's important. So I think it's been a long fought battle. Lots of politics have played out, and I think what next is that I don't think the job is even close to finishing. So, excuse me again. I think we need to make sure that those populations of people who could benefit from PrEP know about it, and knowledge is really the first stepping stone into accessing it. And we know that there are whole populations of people who don't know about PrEP. So there's lots of knowledge-based work to do. And we also know that if you look at the most recent data, who are the people who are most likely to be diagnosed with HIV in a place like London? It's people who don't always have English as a first language, or may have other vulnerabilities that are playing out. About half of the MSM, gay and bisexual men who were diagnosed with HIV last year in London weren't born here. So there's a whole set of structural inequalities that need attending to, but there are also things that our organizations can do. And I'm really glad that both Gianluca and Jose are in this conversation, because they're two really good examples of what our organizations can do, which is we can employ people who are from those communities. We can employ people from places like Mexico and Italy and Brazil and all these other places where people who are being diagnosed with HIV in a place like London, where they come from. So there's some cultural resonance where languages are being spoken. I mean, I think, let's go back to the Impact trial. All of the information on the Impact's website was only in English. I mean, this is absolutely ridiculous. It should have at least been available in languages, such as Spanish and Portuguese and Polish, given what we know about HIV prevalence. So there's some really, really simple things that our organizations can do and are doing. But the other thing that I want to press, and we've kind of touched upon this, is that we all know that one of the most effective ways of telling people about new HIV prevention technologies or contraceptive methods or whatever they might be are through conversations like the ones we're having here. We don't learn about them through millions and millions of pounds being put on the backs of buses or on tube stations. That's not how people know about these new technologies. It's not how we get over the stigmas and the barriers. It's events, it's outreach, it's the kind of thing that Edith has already touched on about having discussions in our communities. And it's about those of us who are using PrEP right now being able to step forward and talk about our own PrEP use. That's what's changing the conversations, not through spending millions and millions of pounds on broadcast media and social media adverts, which have some impact, but those are the things, so outreach is the things that's being disinvested in right now, with very, very little disinvestment in ads on Facebook and ads on backs of buses.
I mean, I agree. I mean, I think, but again, harking back to the days, as a gay man in his early 20s, the thoughts, that in 20 odd years time, you'd be talking about with like gay friends about, have you taken your PrEP? Do you take PrEP? Do you have these? The fact that we're kind of having that conversation, is amazing. Like I said, I've got friends who take it and on a regular basis, because for them, it's they take it daily. It's like they take it with a vitamin tablet. They take and it's done and it's great. And it doesn't mean that they're going to be out having sex every day. It's protecting their health. For someone who's new into this sector, I think it's what I found amazing is that sexual health. There's still a stigma about taking care of your sexual health. There was still a stigma about going to get a checkup. What's wrong? Women have been going for women checkups. What is wrong with a guy going to get a checkup, getting his STI screening done, getting a testing done, and what have you? We take care of our teeth. What is wrong with taking care of our sexual health moving forward? And the fact that, Jose, you mentioned about somebody wanted their children to know about it. Surely the next step is that educating teenagers, younger people. They're going to have this information, so moving forward, they can educate. They can say to their friends, "Oh, I'm taking this, because I'm taking care of my sexual health." I think is amazing, and I'm not wanting to appear flippant, but I think it's we don't realise the work that has been going. We don't realise that this has been a battle for, like you said, nearly 12, 13 years. Well, it's now coming into the fore, and then the media, it gets sometimes the media, as the media can, gives it. I think I saw it tagged as the gay morning after pill, and it's like, really, no. If you look at the kind of cost of that versus the cost of having to treat somebody with HIV, it gets quite frustrating. One thing I did want to kind of touch on was about the formats, and obviously at the minute it's just a pill, and we'll come back to that later. I think as well, I mean, obviously, we're kind of focusing around separate parts of London here, and I think, to a degree we get perhaps a bit London-centric. Obviously, we're focused on London. We live in London. It's, there are benefits to living here. Thinking, UK-wide, somebody like me who grew up in a kind of town in backwater of Yorkshire, how do you think we could educate somebody like that? How are we going to get to somebody like that? I mean, I agree, talking to them, and I mean, how are we going to get to them? I mean, it's an open question to the floor. How do we kind of get to those people who perhaps aren't going to have access to the stuff that we provide? I don't know. Gianluca, any ideas?
Well, I think is in the same format, in the same way people are getting information here in London. We need activists, and we need charities like us out there informing people. I think is one of the main way, as Will was saying.
From my personal experience, I mean, I'm talking to that one guy in a bar in Soho, and that light bulb moment. It's kind of it's almost like you want to kind of be able to go around the country creating those light bulb moments, and for people to realise. I'm not saying there are obviously there's big we've got kind of peer agencies in Manchester and Leeds and Edinburgh and Leicester and Birmingham and that. But I suppose it's for, it's being able to kind of help those people who perhaps aren't in those areas, but maybe that's a conversation for another day and perhaps a different agency. I don't know. I suppose what I did want to come back to, but I mean, we've only got about 10 minutes left, but obviously at the minute, PrEP is a pill. It's taken in tablet form. You touched on it earlier, Will. Could we possibly see that in years to come, it would be a 6-monthly injection? And that would, I don't know, what do you think? Any ideas, suggestions, hopes, fears?
So there is great new research on the horizon. There's just been a new cervical ring that's been approved for some parts of the world, and so that would involve having a slow release amount of PrEP that a woman with a vagina would insert into herself, a bit in the same way as we use contraceptive rings, cervical rings. The great thing about some of the new technology that's been developed is that they're trying to do a combination of PrEP and contraception into one device. So that would then mean that you would get over some of the obstacles of maybe having to make a choice about which device you use. There's also, John, some really encouraging research that's coming out about slow release forms of injectable PrEP, a bit like long-acting reversible contraception, and again, starting to query about whether you could have that injection for that release for both PrEP and contraceptive methods, and also looking at, as you said, some long-term injectable PrEP methods that may last 6 to 12 months. I think there are pros and cons of each different method, and some different populations of people might be more attractive to one method than to one other method. I personally have no problem taking a pill every day, and I would much rather take a pill a day than having someone stick a needle in my arm. I'm a big sissy when it comes to stuff like that, having things put into me. But different methods will float different boats for different people.
Of course. I mean, some of the work we've done with kind of, young people who perhaps, or people perhaps, with more chaotic lifestyles who, have kind of see the benefit of, I have an injection once every 3 months, or if it's a contraception injection, like you, I would take it daily with my vitamins in the morning or any other medication that I was taking. I think, it just, once you get into that kind of sort of mindset, it's just there, and it's something that just happens without thinking about it really. And kind of one that's sort of like wrapping up within the next 5 minutes. I just wanted to perhaps get last thoughts from everybody. I mean, personally, like I've said, and I've said it a few times, that 30 odd years ago, I didn't think we would ever be in this position where, we would have such advances in treatment of HIV, or, as I was being told by the medium of ads and tombstones, it was AIDS, that, we would get to this position, which, is amazing, really. Gianluca, any, thoughts from you, last thoughts about PrEP, or, hopes, anecdotes, things that have kind of stuck out for you over the past few years?
No, I'm just interested to see what will be the future on it, and I just hope to keep seeing people more interested on PrEP and more people on PrEP.
Edith, how about you? How do you any comments? Anything to add?
Yeah, I think for me, it's with PrEP where it is now. Let's keep the conversation going. Let's engage the communities in, provide more information, engage them, keep the knowledge flowing in the community so that, people can learn about all the new information about PrEP, and then there won't be fear of PrEP. There won't be stigma. There won't be, people will be, able to access PrEP as well, yeah.
Cool. Jose, anything to add from you?
Yeah, I just wanted to add a little bit the question you had of, you know, how do we reach people outside of London, or how, you know, I think we kind of need to stop thinking that in that way. I guess, you know, talk to organizations outside of London, partner with them. I know from experience, you know, we went to Manchester to go engage with Latino communities, and we were overwhelmed by the amount of you know, an organized community that was there amongst Latinos. So I think we need to get out there. We need to do it. We need to spread the message, and you know, spread the message to, like Will was saying, in different languages and different ways of doing that. You know, not just plopping a sign up on the bus or something like that, but actually going and talking to the people and explaining to them why this is an important conversation for us to have. And we'll be surprised how much people actually want to talk about it if we approach it in the right way.
Definitely. And Will, any last words from yourself? Anything you want to add?
Yeah, I think following on from what Jose has just said, that I think we also, for me, the next stepping stone to getting PrEP much more widely available is to move PrEP provision beyond sexual health services. We know lots of women in particular don't go to sexual health services for their sexual health or contraceptive needs. They go to their family doctors. So we should be looking at how we can ensure that PrEP and information about PrEP is available from contraceptive services, from family planning services, from termination of pregnancy services, from all of the kinds of services that different populations might currently use other than sexual health services, and see if PrEP can be available from them. We need to normalize PrEP in the same way as we normalize, you know, everyday health services.
I mean, I agree. I mean, it'd be good to think, I mean, for services like ourselves, that a lot of outreach that kind of, you know, gets to kind of actually, you know, feet on the ground, serving the community, you know, where, you know, who knows, maybe it's just wishful thinking that we can hand out condoms left, you know, we could hand out PrEP. I don't know. Maybe I'm just, you know, it's just a kind of pie in the sky wish. I don't know. That's it, I'm afraid. That's all we have time for. I'd love to say a big thank you to everybody who joined us today. So obviously Gianluca, Edith, Jose, and Will. Obviously, again, I'd like to say thank you to Julian from Wandsworth and Richmond Council Sexual Health Service Development Agency. Obviously, for people of Wandsworth and Richmond, we, myself as Spectra and Metro, obviously kind of working in the area. And again, obviously, we're kind of limited at the minute on outreach due to lockdown 2.0, but we have got services online where we can kind of support with kind of HIV testing and so on and so forth. So our websites are going to be available on this webinar as well. In addition to that, the services will be on the wandsworth.gov UK website and the London Borough of Richmond Council's website as well. So with a few minutes left, it just leaves me to say thank you to everybody. Thank you for giving your time up. It's much appreciated. And we will perhaps see people next month for a different conversation. So goodbye.
Bye.